Epilepsy by Jennifer Montgomery. Epilepsy is a chronic disorder that causes unprovoked recurrent seizures. A seizure is a sudden rush of electrical activity in the brain. There are two main types of seizures. Generalized seizures affect the whole brain, while focal or partial seizures only affect one part of the brain. A mild seizure may be difficult to recognize. It could last a few seconds, during which a person lacks awareness. Stronger seizures can cause spasms and uncontrollable muscle twitches. They could last a few seconds up to several minutes. During a stronger seizure, some people become confused or lose consciousness. After the seizure occurs, you may have no memory of it happening and become very weak and tired. For more information about epilepsy, please click on the link below. Some characteristics of epilepsy are unexplained staring spells, stiffening of muscles, involuntary jerking of limbs, facial twitching, unexplained confusion, severe headaches. Other less specific symptoms can include sleepiness or sleep disturbances, marked and unexplained irritability or aggressiveness, regression in normal development. Epilepsy has no identifiable cause in about half of those with the condition. In the other half, the conditions may be traced to various factors. Genetic influence. Some types of epilepsy, which are categorized by the type of seizure you experience or the part of the brain that is affected, runs in families. In these cases, it's likely that there's a genetic influence. Researchers have linked some types of epilepsy to specific genes. Though it's estimated that up to 500 genes could be tied to the condition, for most people, genes are only part of the cause of epilepsy. Certain genes may make a person more sensitive to environmental conditions that trigger seizures. Head trauma as a result of a car accident or other traumatic injury can cause epilepsy. Brain conditions that damage the brain, such as brain tumors or strokes, can cause epilepsy. Strokes are the leading cause of epilepsy in adults older than 35. Infectious diseases such as meningitis, AIDS, and viral encephalitis can also cause epilepsy. Epilepsy can sometimes be associated with developmental disorders such as autism. There are many different ways that epilepsy could affect student learning. Some specific learning problems that children with epilepsy can experience are academic difficulty with reading, writing, math, or language. They could also have difficulty with comprehension, speech, or communication. Attention and concentration problems. The student may be inattentive, hyperactive, or both. The child may only concentrate for short periods of time. It may take the student longer to process new information or to complete tasks compared to other students. There are many drugs available to treat epilepsy. Although generic drugs are safely used for most medications, anticonvulsants are one category where doctors proceed with caution. Most doctors prefer to use the brand name anticonvulsant, but realize that many insurance companies will not cover the cost. As a result, it is acceptable to start taking a generic anticonvulsant medication, but if the desired control is not achieved, the patient should be switched to the brand name drug. Some of the medications are Neurontin, Lyrica, Topamax, and Depakote. Here are a few resources that teachers can use to help them aid with epilepsy in the classroom. Thank you. I hope you learned a lot about epilepsy and its effects that it can have on our students.